A video was done to further explain the case conceptualization with feminist therapy, which includes psychodynamic, Jungian, and cognitive behavioral therapy frameworks. Included in the video, but not present in the case conceptualization, are objectives for each goal, unique resources, interactional patterns, cross-generational coalitions, hierarchy between parents and children, intergenerational patterns. The main point of the analysis is to work on the issues related to Kayla's substance abuse disorder and adjustment disorder. Further consideration may be made to assist Kayla with her decreased attention at work and withdrawal from more challenging tasks by focusing on past achievements and reinforcing the significance of Kayla's role as an examination specialist. Okay. Okay, case conceptualization is a clinical strategy for obtaining and organizing information about a client. It's described as a process and cognitive map for understanding client issues. Okay, the introduction. Kayla is a heterosexual 42-year-old African American woman bank examination specialist. She was born in the United States and currently resides in Baltimore, Maryland, and she's seeking therapy for substance disorder and adjustment disorder. Presenting concerns are decreased attendance at work and withdrawal from more challenging work assignments. Precipitants or triggers are recent travel increase between work and home 2 times per week instead of remote 5 times per week. These are stressors that are happening in Kayla's life. Her prior manager was very supportive and understanding of her condition and how it affects her work. But due to his promotion, she has a new direct supervisor. Precipitant. A recent breakup following a 6-year relationship. Trauma abuse history. There is no history of sexual or physical abuse within her immediate family background, but Kayla was involved in a relationship where she experienced domestic abuse. Okay, trauma abuse history. There is a maternal and paternal history of substance abuse with Kayla's aunt on her mother's side and both grandfathers on her maternal as well as her paternal side. Trauma and abuse history. There is a history of domestic abuse with several aunts in the family, and that led into divorce. Related historical background. Kayla was raised in a 2-parent household. She attended public school, and she's a second-generation college graduate. She's the firstborn in her family. Client strengths. Kayla has a large social network due to involvement in sorority life and close ties to immediate and extended family members. Client strengths. She is a leader in life who is outgoing, independent, successful, and hardworking. She has a knack for home interior decorating, and her love of self-help books assist her with coping with stress. Some protective factors and strengths include mindfulness-based relapse prevention weekly, her attendance in a women's executive functioning group weekly, outpatient continuing care through Pathways weekly, and Kayla has been in her job for 21 years. She has a close relationship with her siblings, and she has health insurance. Relational or social. She experiences challenges with substance abuse, which have caused her relationships to become more distant. She pursues relationships quickly and is known to wear her heart on her sleeves due to fear of being alone and desire for companionship. Both her siblings are either unemployed or underemployed, and her recent feelings include being disconnected from her family due to location and distance. Spiritual. She attends a non-denominational church and actively participates in a weekly Bible study over the phone. Unique resources. Kayla has a home organization assistant as well as a housekeeper to assist her with maintaining a tidy living space. Potential limitations. Being the oldest in her family puts a lot of pressure on her. She is feeling weighed down with physical accumulation of things and feels clutter creates shame. Kayla has recently accumulated some debt. She internalized her lack of promotion at work and made a lifestyle comparison with the person who received the promotion. And Kayla mentioned that the person who received the promotion was a married woman who had a child who was not tenured. And so she really internalized that because she felt like she deserved that promotion. Family structure. Kayla had a traditional household upbringing where her father made the money and most of the decisions. Her mother was a homemaker. She grew up in a home with both siblings. Faith, family, and education were all values that were upheld in the household. There was a patriarchal dynamic. Struggles. Kayla struggles with deficits in assertiveness skills and anger management. She also does not have anyone outside of herself to depend on financially. And so those are some psychological things that she struggles with. Interactional patterns. Kayla usually communicates over the phone with family members because she lives about 2 hours away with the exception of monthly visits. She has recently started living in the home with her parents partially to assist with her father's recovery following surgery. The family displays clear communication, freedom of expression, and cooperation amongst family members. Okay, Kayla is single. She's not married and does not have any children yet. She struggles with finding financial reciprocity in relationships. However, she has been able to maintain her current class status. Parents. Kayla's parents are in their 70s and have been married over 50 years. The husband, father, still makes most of the decisions, and they actively attend church together. Siblings. Kayla has a younger brother and a younger sister. Her brother is married and her sister is single. Her brother lives in a different state now, and they usually communicate weekly. Cross-generational coalitions. There are no cross-generational coalitions present at this time. Hierarchy between parents and children. Kayla's father was the provider and disciplinary in the household. Both parents actively raised the children by ensuring they completed school, keeping them engaged in activities, exposing them to the church, and ensuring the safety and well-being of all children up to and throughout adulthood. Intergenerational patterns and attachment patterns. Both Kayla's mother and her great-grandmother on both the maternal and paternal side were stay-at-home mothers and homemakers. No attachment patterns are present or known. And that's no attachment patterns for the family. She presents with an avoidant attachment style in her romantic and social relationships. This attachment style is developed in childhood when the child doesn't receive emotional care and support as needed. Prognosis. Kayla's final prognosis consists of adjustment disorder with anxiety, generalized anxiety disorder, alcohol abuse with intoxication unspecified, major depression disorder, recurrent, moderate, and problems in relationships with spouse or partner. The plan or treatment: assertiveness training, gender role analysis, and therapist disclosure, along with a highly supportive and empathic and encouraging counseling relationship, are part of Kayla's plan. Kayla will also receive a referral to a support group for anger management. And that was one of the things that Kayla did not really agree with. She did not acknowledge or agree to having issues with anger. Feminist therapy. Kayla will have 6 goals representing the 6 core tenets of feminist therapy, along with 2 objectives for each goal. This therapy was selected for her because she is in a male-dominated industry and has experienced domestic abuse. Feminist therapy. Okay, skills will be implemented through modeling, uncovering the presence of patriarchy, increasing client awareness of colonization and internalized racism, and consciously criticizing social norms and structures. And so an example of that, consciously criticizing social norms and structures, as we go back to Kayla having a hard time experiencing financial reciprocity in relationships. As a therapist, I would let her know that she has to kind of think it's okay to think outside the box, and the man doesn't always have to make more money, even though she did grow up in a traditional household where the man did make more money and was the sole provider within her family. And so we're just trying to allow Kayla to see things from a different perspective, that it's okay if the man makes just as much money or less money than you, and just learning how to value the person as a whole as opposed to how much money that they provide or that they're able to provide. Feminist